So this is Cheryl Hazard, and I have had to do research on both the COVID infection, and some of what it was doing and how it was affecting people and why it was lethal. And then I was investigating about AIDS, a sexually transmitted disease. It starts out as HIV and converts to AIDS, and it becomes a disease that is very fatal and it can attack people's organs, much the same way that COVID did, I believe. And I found that zinc deficiency can play a role in both illnesses. And apparently, zinc plays a huge role in modulating the immune system. And, it kind of makes sense in a way because, like, zinc controls how much histamine is released. So that's like an immune reaction of what happens when the immune system's out of control. Too much histamine gets released if it's not stopped. And, so zinc modulates the immunity. And they said that with AIDS, the level of zinc in the body determines or plays a role in how fast HIV becomes AIDS. And those who don't have enough zinc, it converts to AIDS faster. And so I wish that they'd been able to take a look at Gia Karanji, who was the famous model. She had a drug problem, and she ended up getting AIDS, and she died from it. And when they pulled her off the bed, her back just peeled. The skin on her back just peeled right off. I mean, yuck. That's pretty horrible. But back then, I don't know if they knew that about the factor about zinc. And so I think and they were looking at people in the hospitals in Spain about the levels of zinc with COVID. And those that had the higher level zinc had higher survival rates or chances. And so we're looking at this epidemic like, we could have put zinc in people more easily. I get zinc supplements at the store. These are things people could get everywhere. Um, but there was less information known when they first were diagnosing people with AIDS about the mechanisms and how that particular illness worked. But I would also be intrigued to know if there's a similar mechanism from AIDS to the Spanish flu, which happened many years before then, to see if there's a similar mechanism there. Because that means that there could be years of study to find out how these major epidemics kill people. And if there's a similar mechanism in all of them, well, maybe we could wipe out many epidemics or stop many epidemics from killing people.